Welcome to the deep dive. Today we're getting into something quite specific, a behavior you might see in pets called head pressing.
That's right. It's when you might see a dog or cat just pushing his head against a wall,
Ah,
or maybe furniture.
exactly, and kind of persistently, for no obvious reason. Have you ever seen that and thought, what's going on there? Well, this deep dive is for you.
hmm We've looked at excerpts from a veterinary guide, some really detailed stuff, to try and build a clear picture.
So our mission today is basically to understand what head pressing really is, what might be causing it, and importantly, why it's considered a pretty significant sign in animal health.
Yeah, definitely something vets take seriously.
Okay, so let's start with the basics. What is head pressing? The guide defines it as a compulsive, repetitive action.
Right, this pushing the head against something solid,
Yeah.
a wall, a corner, furniture.
And the key phrase seems to be for no apparent reason. It's not just, scratching an itch or affection.
Exactly. That lack of an obvious why is what flags it as potentially abnormal. It's beyond typical behavior.
So it suggests something else is going on underneath. Where does the guide point us, neurologically speaking?
Okay, so this is where it gets interesting. The guide links head pressing specifically to problems in the prosencephalon.
The prosencephalon.
Mm.
Okay, for most of us, what parts of the brain are we talking about?
That's basically the forebrain. So think cerebrum, the limbic system, thalamus, hypothalamus. The guide particularly calls out the limbic system and the frontal and temporal cortices.
Right. And how does damage or an issue there lead to this specific behavior, the head pressing?
Well, the thinking is that lesions, damage or abnormalities in these areas can mess with how the brain processes information and controls behavior.
Okay.
So it can lead to things like compulsive pacing, just walking back and forth or in circles. And if an animal is pacing compulsively and meets an obstacle, like a wall,
Ah.
the damaged part of the brain might not process the signal correctly to, turn away or navigate around it.
Hmm.
So they just keep pushing forward. They get stuck.
So it's like a breakdown in processing sensory input, leading to this inappropriate, stuck behavior. The nervous system is really the key here.
Absolutely. It's a neurological sign, first and foremost. And it's important to know this isn't specific to, say, just old dogs or a certain breed.
Oh, really?
Yeah, the guide mentions it can happen in dogs, cats, any age, any breed, male or female.
Okay. And the guide also stresses that head pressing is often just one piece of the puzzle, right? It usually comes with other signs pointing to that same area of the brain, the prosencephalon.
Exactly. You rarely see it in complete isolation. You've got to look at the whole clinical picture.
So what else might you see alongside it?
Well, we mentioned the compulsive pacing and circling. That's a big one.
Right. Does the direction they circle matter?
Sometimes. Often they circle towards the side of the brain lesion. But if the lesion's more central or widespread, they might circle either way. You might also see changes in learned behaviors like house training issues suddenly cropping up.
Okay, that makes sense if memory or learning centers are affected.
Seizures are another major sign associated with prosencephalon problems. Also, something called contralateral postural reaction deficits.
Contralateral, meaning
Yeah.
the opposite side.
Yeah. So if the lesion is on the left side of the brain, you might see weakness or coordination problems in the right side limbs, like they don't place their paw correctly when you test their reflexes.
Got it.
You could also see contralateral visual deficits, trouble seeing out of the eye on the opposite side to the lesion, even if the pupil reacts to light normally. And maybe contralateral facial hypalgesia,
Just?
reduced sensitivity to pain on that opposite side of the face. So a whole cluster of potential neurological signs. Yeah.
Wow. Okay, so head pressing is like a visible alarm bell, but there could be other things flashing too. Let's dig into the causes. Why would these brain issues happen? The guide breaks them down into categories, which is helpful.
It is. It helps organize the possibilities. First, they list anatomic causes. Think structural problems.
Like what?
Hydrocephalus is a common one, especially in younger toy breed dogs. That's fluid buildup in the brain, water on the brain. Also, lysencephaly, a rare condition where the brain surface is smooth instead of wrinkled, seen in breeds like Lhasa apsos.
Okay, structural issues. What's next?
Metabolic causes, so problems with the body's chemistry affecting the brain. Hepatic encephalopathy is a big one here.
That's related to the liver, right?
Exactly. From a portosystemic shunt, which is like abnormal blood flow bypassing the liver, or just severe liver failure. The toxins build up and affect the brain. Also, really severe imbalances in sodium, either too high or too low, can cause neurological signs like head pressing.
Interesting. Then there's nutritional.
Yeah, though the guide notes this is pretty rare now with good commercial diets. But thiamine deficiency, vitamin B1, could potentially cause it. This might happen in cats eating a lot of raw fish, which contains an enzyme that breaks down thiamine, or pets with absorption problems, though usually you see more balance issues, vestibular signs with thiamine deficiency.
Right. Okay, what about more serious things like neoplastic causes?
Yeah, unfortunately, brain tumors. These can be primary, starting in the brain, like gliomas or meningiomas, or they can be metastatic cancer that spread to the brain from somewhere else, like hemangiosarcoma.
And are those more common at a certain age?
Generally, yes. The guide suggests they're more frequent in older animals, say over 6 years old.
Okay. Then we have immune-mediated or inflammatory conditions.
Right. This is where the body's own immune system attacks the brain, or there's inflammation for other reasons, things like GME, granulomatous meningoencephalitis, or specific types of encephalitis seen in breeds like pugs and Maltese. Sometimes they just call it meningoencephalitis of unknown origin, or MUO.
So inflammation in the brain, and then, of course, infectious causes.
A big category. And it differs a bit between dogs and cats.
Okay, let's start with dogs.
For dogs, the list includes viruses like rabies, and the guide specifically mentions rabies likes the limbic system, which fits perfectly with head pressing and canine distemper.
Yeah.
Then rickettsial diseases like Ehrlichia and Rocky Mountain spotted fever carried by ticks.
Protozoa, too.
Yep, Toxoplasma and Neospora. And fungal infections like Blastomyces or Cryptococcus. So quite a few infectious possibilities in dogs.
And for cats, similar things.
Some overlap, some different ones. Rabies again, definitely. FIP, feline infectious peritonitis. FIC-VW, feline leukemia virus, which might not directly cause it but can predispose cats to other infections. FIV, the feline immunodeficiency virus, can cause brain issues.
Any others for cats?
Bacterial infections like Bartonella, the cat scratch fever bacteria. Parasites like migrating Cuterebra larvae, weirdly enough. Toxoplasmosis again. And fungal, particularly Cryptococcus.
Wow, quite the list for infections. Are there other categories?
Yep, a few more. Toxic causes lead poisoning is the main example given.
Lead poisoning, okay.
Trauma, obviously. A head injury could certainly damage the prosencephalon.
Makes sense.
And finally, vascular problems. So, issues with blood supply. This could be bleeding in the brain, maybe from high blood pressure, a clotting disorder, or even rat bait toxicity. Or ischemia, which is lack of blood flow, like a stroke.
And that high blood pressure link, especially in older cats.
Right. The guide notes hypertension in older cats can be secondary to other common issues like hyperthyroidism, diabetes, or chronic kidney disease. So you have to look for those too.
Okay, that is a huge range of potential causes. It really drives home why seeing head pressing means you need to get it checked out. So when a vet sees this, how do they start sorting through all these possibilities? What's the differential diagnosis process like?
Well, a key thing the guide mentions is distinguishing it from other reasons an animal might bump into things, like, say, sudden blindness.
Right, how do they tell the difference?
An animal that's just gone blind might be disoriented at first, bump into stuff, but they tend to, adapt. They learn the layout. An animal head pressing due to a brain lesion often doesn't adapt. They just keep compulsively pushing. Their vision might actually be fine.
That's a really useful distinction. Okay, so what diagnostic tools do vets use to narrow down the cause?
They usually start with baseline tests, a CBC, a biochemistry panel, a urinalysis. These can pick up clues for metabolic problems, like liver disease. You might see low albumin, low BUN, maybe high liver enzymes.
Anything else those basic tests might show?
They might hint at toxic causes like the specific changes in red blood cells called basophilic stippling with lead poisoning. But it's interesting, the guide also says that for some brain inflammation cases like encephalitis, this initial blood work might look completely normal.
So you often need to go further. What other lab tests?
Definitely. If liver disease is suspected, they might do bile acid tests or check blood ammonia levels. For infectious diseases, there are specific serologic tests looking for antibodies, or PCR tests that look for the pathogen's DNA or RNA. These can often be run on blood or, importantly, on cerebrospinal fluid, the CSF.
CSF, that's the fluid around the brain and spinal cord.
Exactly. And if lead is suspected, you need to measure the blood lead concentration.
What about actually seeing what's going on? Imaging.
Crucial. Chest and abdominal x-rays or ultrasound are often done, especially in older pets, looking for primary cancers that could spread to the brain, or checking the liver size and structure. There's a specialized scan, rectal scintigraphy, for diagnosing portosystemic shunts.
But for the brain itself?
For the brain, you really need advanced imaging, CT or MRI. These are the best ways to see structural changes like tumors, hydrocephalus, inflammation, bleeding, or trauma within the skull.
Is ultrasound ever used?
Sometimes, yes. In very young puppies where the fontanelles, the soft spots on the head, are still open, you can sometimes use ultrasound to look for hydrocephalus.
Okay. Any other diagnostic procedures?
A thorough eye exam, a fundic exam, is important. It can show changes in the back of the eye like inflammation or vascular issues that might reflect a systemic infectious or inflammatory disease affecting the brain too. Measuring blood pressure is key to check for hypertension.
And collecting that CSF fluid you mentioned.
Yes, a CSF tap or a spinal tap.
Yeah.
Analyzing that fluid is often essential for diagnosing encephalitis or meningitis. And, well, sometimes the final diagnosis comes from pathology after an animal passes away, looking at the tissues directly.
Right. So once you have a diagnosis, or at least a strong suspicion, what about treatment? It sounds like it has to be tailored to the cause.
Absolutely.
Yeah.
There's no single treatment for head pressing itself. You have to treat the underlying disease. That's why the diagnosis part is so critical.
And for severe cases.
Hospitalization is often needed for diagnostics and intensive support. And we need to mention the rabies protocol again if there's any suspicion. Strict quarantine and specific handling procedures are mandatory because it's fatal and transmissible to humans.
What about general nursing care while they're hospitalized?
Really important. Monitoring their mental status closely, watching for seizures. 4 fluids are often necessary. Padding the environment helps prevent self-injury from the pressing or pacing. Checking their eyes for ulcers from rubbing is key. And the guide suggests using leg veins for FurV catheters rather than the jugular vein in the neck to avoid potentially increasing pressure inside the head.
And activity or diet?
Usually no specific activity restriction because of the head pressing, but the underlying condition might require it. Diet-wise, if it's hepatic encephalopathy, a low-protein diet is usually needed. Sometimes they need help eating, maybe hand feeding, but you have to be careful they don't aspirate it if their swallowing is impaired.
What about client education? What do owners need to know?
They need to know about the possibility of seizures, what to look for, and what to do. And critically, they need to know the signs of acute deterioration, like sudden changes in mental status, which could indicate dangerous swelling or pressure in the brain.
Are there surgical options for any of these causes?
Sometimes. But there are risks. Anesthesia itself can be risky. If there's already increased intracranial pressure, it could cause brain herniation. So careful ventilation and monitoring are vital. Surgery might be an option for hydrocephalus placing a shunt or for some accessible brain tumors, like meningiomas.
And finally, medications.
The big takeaway is, don't just start treatment without a diagnosis. If brain swelling is a major immediate concern, vets might use mannitol or hypertonic saline as an emergency measure to temporarily reduce pressure, but it's not a long-term fix. And caution is advised with sedatives.
Why caution with sedatives?
Because they can mask changes in the animal's mental status, which is crucial for monitoring, and they can also suppress breathing, which can sometimes worsen intracranial pressure. So careful use, if at all. And of course, follow-up with repeat neuro exams is always needed to track progress.
Okay, so wrapping this up, it's really clear that head pressing isn't just some weird quirk. It's a serious neurological sign.
Definitely. It signals something significant is likely going on in the forebrain.
And it absolutely warrants a veterinary visit to investigate all those potential underlying causes we talked about.
Precisely. Getting to the root cause is the only way to figure out the right treatment.
It really makes you appreciate how these sometimes subtle or strange behaviors can be windows into really complex processes happening inside our pets. A good reminder to pay close attention.
Absolutely. It's a fascinating, though often worrying, sign that tells us a lot about the brain's function.